pronunciation, Taiwan.
Thank you. Hello, everyone. I'm Mei Qi from Taiwan. I'm honored to present our findings on 3D visualization system for vitreoretinal diseases in highly myopic eyes. These are my disclosures. The incidence of high myopia has increased rapidly in recent decades. Patients with high myopia have a higher risk of developing vitreoretinal diseases, such as epiretinal membrane, myopic traction maculopathy, with or without foveal detachment, full-thickness macular hole retinal detachment. These diseases have been reported to treated with vitrectomy combined with internal limiting membrane peeling with favorable outcome. Recently, 3D visualization systems such as Alcon New Genuity has been reported to offer better visualization, improved magnification, extended depth of field, and lower illumination. However, the majority of prior investigations focus on non-highly myopic eyes. The purpose of this study was to specifically investigate the intraoperative parameters when utilizing Alcon New Genuity compared to conventional microscope for vitreoretinal diseases in highly myopic eyes. A total of 40 patients, each exhibiting an actual length exceeding 26 millimeters and diagnosed with vitreoretinal diseases that require vitrectomy, were randomly assigned to 3D group or conventional microscope group. The primary outcome was the number of injections of ICG, and secondary outcome encompassed surgical time and complications. A 0.05% of ICG was used to stent the ILM. Each injection was kept for a fixed duration of 15 seconds, followed by a 10-second washout period. The quality of ICG stent was assessed as excellent, adequate, or inadequate. If the quality was judged as inadequate, an additional injection was given and the procedure was repeated until the ICG stent was adequate for membrane peeling. Allow me to elaborate on the choice of ICG over BBG. ICG has been reported to outperform BBG in enhancing the visibility of ILM, as you can see here. In highly myopic eyes, the ILM may be very difficult to detect due to the thinner and tessellated retina. BBG alone often falls short in providing the adequate visibility of ILM for membrane peeling, as you can see here, is after BBG stent, but not adequate for membrane peeling. Even when ICG stent is used, it often requires repeated dye injection and washout to increase visibility of the ILM. Baseline demographics including age, gender, laterality, actual length, visual acuity were all comparable between the two groups. The mean number of ICG injections was significantly lower in the 3D group compared to the microscope group. The ERM-ILM peeling time was much shorter in the 3D group compared to microscope group, while the vitrectomy time or the total surgical time were comparable between the two groups. There was no retinal brag or detachment in both groups. No retinal hemorrhage was noted in the 3D group, whereas there were 7 cases in the microscope group. Our study revealed a reduction in the mean number of ICG injections, a shorter ERM-ILM peeling time, and a lower incidence of intraoperative retinal hemorrhage in the 3D group. Therefore, 3D visualization system could help reduce ICG exposure, thereby minimizing its potential toxicity to retinal cells. And it might have an advantage for vitreoretinal surgery in highly myopic eyes. I would like to express my gratitude and acknowledgement to my mentor, Dr. He. And thank you very much for listening.
Yeah, so now we have time for questions. I would like to ask all